welcome, welcome, and thank you for spending some of your time with us. My name is Tina Rosenquist, and this is Knowledge for Wellness. And this show is to better inform you, because the more information you have, the better decisions you can make. And today I am delighted to present Dr. Roy Hakula, and he is from the Minnesota Craniofacial Center located in St. Paul, Minnesota. Welcome.
Thank you for having me.
It's a delight that you could join us. And our topic today is on sleep apnea, but before we get into that, I would really like you to talk a little bit about yourself and your decision to pursue this field of medicine.
Well, I started out as a general dentist, and I had a general dental practice for over 20 years in Red Wing, Minnesota. But along the way, I did a fair bit of orthodontics. In fact, I taught orthodontics for over 10 years. And in the process of doing that, some research came to my attention indicating that you can actually do things with airways, with snoring, which was the major concern that early in the whole process, with modified orthodontic appliances. And this became fascinating because I'm a heroic snorer myself. So I had to treat myself as well as other people who requested it. And it simply grew and grew. In 1994, I opened the Minnesota Craniofacial Center, Midway, in St. Paul, and the focus there is entirely on treating snoring and sleep apnea, and with treating TMJ disorders too, which are related. Practice is roughly half and half.
Okay, wow. Well, that's good to know, and we are delighted to have you on our show for Knowledge for Wellness to get this out to our viewers, of course. And I guess my first question is to share with our viewers exactly the definition of what is obstructive sleep apnea, and it's also known as OSA.
Yes.
So if we can get into the definition a little bit, and then they can kind of know if that's something that them or a loved one also has.
Certainly. Well, apnea means without air. So sleep apnea means someone who's not breathing in their sleep. People will obstruct, that is, structures in the throat will close down so they can't breathe for periods of time. If that occurs for more than 10 seconds at a time, it's called an apneic episode. People will have as many as 100 or more apneic episodes in an hour. And then typically they will cough or choke slightly, jerk themselves. This is called an arousal. They don't actually wake up, but it interferes with their sleep quality. And of course, if they're not breathing well throughout the course of the night, their oxygen perfusion diminishes too. That is, their blood is carrying less oxygen than it ideally could. As you sit in a chair quietly, as we are right at the moment, your blood is probably 98 to 100% perfused. It's carrying all the oxygen it can. When people obstruct during the night, when they have apneic episodes during the night, that perfusion level goes down quite low. If it goes below 94%, typically people start having trouble with short-term memory. Mm-hmm. If it goes below 90%, we get concerned about systemic problems. And for many people, it goes far lower. I've seen some whose perfusion is down in the high 50% range.
Wow, and that's pretty scary because sleep is so important. And if we don't have sleep, then of course everything seems to fall, and gets worse into place. And I know a lot of people snore, and then we're concerned, well, is our loved one getting good rest? So is snoring also a part of OSA?
It is. There's really a continuum where OSA and actual apneic episodes are at the end of the continuum. That is, people are stopping their breathing completely for 10 seconds or more. One step up from that is called hypopnea. That's where people are still breathing, but they're getting less than half as much air as they should at any given time. There's one step above that called upper airway resistance syndrome. That's when people do get all the air that they need, but the chest wall is working so hard to bring the air in and get it back out again that they don't sleep restfully. Their sleep stages are poor, and they wake up tired no matter how much sleep they've had. People with upper airway resistance syndrome are typically the ones known as snorers. The resistance comes from the soft tissue structures in the back of the throat that partially blocks the airflow, and that extra air pressure is what causes the vibration and the snoring.
Okay. Well, I know I have met quite a few people that have been diagnosed with this. So that's another concern that I have. So besides snoring, why is OSA a concern?
It's related to a number of systemic problems. As I said, the very obvious one is short-term memory loss. That is, people will wake up in the morning and not remember where they are, can't remember if they took their pill, where their keys are, and so on. So that's just touching the edge of the problem, though. If people don't sleep well, of course, there are attitude problems, but when oxygen perfusion goes lower, there are systemic problems too. And some of the very common results of obstructive sleep apnea are elevated blood pressure, elevated blood sugar, which means people are at risk of diabetes, elevated cholesterol, which is always a concern, gastroesophageal reflux. In fact, for many people, one of the signs that their sleep treatment is not going well is that they start having gastric reflux again. And as the disorder persists over years, people have diminished immune function. And that's, of course, a major concern right now when we're in the flu season. People don't want to catch things. And chronic lack of quality sleep leads to anxiety, irritability, and depression. Other disorders are involved too, but those are the very common ones, the ones that people are commonly medicated for, and the ones that people with sleep apnea are most concerned about.
Well, it just seems like we're hearing a lot more about this right now. And, back when my mom and dad, they'd say they didn't get a restful night's sleep or something like that. So it just seems like this is new and up and coming. When did we also come up with this sleep apnea?
Well, when was it first defined, I suppose, would be the technical question. And it was defined generally back in the 1950s and 60s, but the science was not very developed at that time. When I started working in the field in the early 1980s, there was only one credentialed sleep center in the state, and now there are dozens. So it's since about 1980 to 85 that knowledge of the consequences and the methods of treatment of sleep apnea have become common or well known.
Okay. So a lot of people are going to the sleep centers now. So is that who's determining if they have OSA or not? Or, how do you know if you have OSA?
Well, the only way to know for sure is to have an overnight sleep study done. This is called a polysomnogram, and this can be done in hospitals or other sleep centers. It's a little bit awkward in that people have to spend the night in a strange bed with a number of sensors on them, sometimes as many as 40 or 50 little electrode patches stuck on them. And they'll often say that that was not a representative night's sleep, that this was not my own bed. And of course, the results of that sort of study may depend on what the person did in that particular day, too. How much exercise did they get? How well did they sleep the previous night? And so on. So an alternative is to do a home study. And there are home equipment sets that you can strap onto your wrist and fingers and throat, and then do a study in your own bed. Okay. It's not as detailed as the polysomnogram, but the correspondence for the most important aspects of sleep diagnosis are at about 90% with the polysomnogram. So it's still a very good study. The only concern about it primarily is some insurance companies will not accept that kind of study as proof of the diagnosis, and therefore they may not cover it. If you have an overnight sleep study done, an attended study in a sleep center or hospital, typically the insurance companies are actually, if anything, anxious to cover that because they want these people diagnosed. People with undiagnosed sleep apnea are likely to experience all these other medical conditions that I mentioned, and those are very expensive to treat. So this is one area where the insurance companies seem to really believe in prevention, not only from a physical or health standpoint, but from an economic standpoint.
Right. Well, when we go on vacation and we don't have all the comforts of home, as we say, you've got the different sounds, you wake up to different situations, even your own pillow, that we like to have and the comforts of that. And so I can see that why they would actually go ahead and take the test at your home. To me, that would be a lot more.
Exactly, and there's an argument that it really is more accurate, even though it records fewer parameters, since it is a more representative type of sleep environment, it may actually produce more accurate results.
Right, and that's what we want. We want to get the right results so that we can, go ahead and treat them what they need to have done to give them better quality of life.
And home studies have another advantage too, in that they can be easily used to determine the effectiveness of treatment. That when someone's treated for sleep apnea, they can do a home study and determine if that treatment is really effective or if it needs to be altered or tweaked in some way.
Okay. So I guess, once you are determined to have it, OSA, then how would we treat that?
Well, the standard treatment is something called a CPAP unit, and that stands for compressed or constant positive air pressure. Constant positive air pressure inflates the throat, and I can show you a picture of that here. And almost everyone these days seems to know someone who has such a device. It consists of essentially a small air compressor that sits on the nightstand, a humidifier that keeps the air moist, a tube that carries the air to a mask, and the mask usually fits on the nose, although there are variations on the masks. And people are constantly inventing new masks of various sorts to try to make them more effective and more comfortable. So this is the very standard treatment. It simply inflates the throat, makes the throat bigger, and therefore air passes through more easily.
Okay. It looks like it's awfully cumbersome though. And I know a lot of people are having some difficulty. My nephew also has been diagnosed, and he, because of moving around in bed, and then all of a sudden it comes off or something comes undone, so now he's choosing not to wear it. And that's more of a concern because of his job, the safety of him, at his profession, because he is a aircraft mechanic. So, in that sort. So I guess I would like to know and share with our viewers the alternative method that you have for CPAP.
Certainly. There are many people who can't tolerate CPAP for all kinds of reasons. Sometimes it's the mask itself, that they develop dermatitis around the mask. Sometimes it's sinus problems, that people are more prone to sinus infections with air being constantly forced in. For many people, it's discomfort. They can't roll over at night, and when they do, with the mask in place, it displaces. And it's fairly common for people to simply start the night with the mask in place and end the night with it having been thrown to the floor. And people may not even remember that they did so.